The battle against COVID-19 raging in our state. Numbers still high, both in diagnosis and hospitalizations, but coming down a little. Joining us with the latest, Singing River Health System CEO Lee Bond. Thank you for joining us this morning. And the hospitalizations we have seen statewide fall this week. We've sort of seen a dramatic decrease. Several weeks ago, the numbers of statewide hospitalizations for COVID patients, more than 1,600. That's dropped now to below 1,300 at Singing River. Are you seeing a similar trend?
We are. We are below 100 patients that are hospitalized with COVID for the first time since it feels like I can remember. Since this fourth wave really hit us, we were up in the 150 range and really stayed in the 140s for weeks and weeks at that plateau. But to be under 100, it's a great feeling, Hugh, and to know that maybe there's an end coming to this, but just to have a little bit of ability to breathe and see a tiny bit of light at the end of the tunnel. It's still tough. It's still very difficult, but it's getting better, we believe.
Getting better. Case numbers are dropping. They are staying in the thousands, or for the most part, reported daily. How does that translate, lower case numbers overall, to daily admissions? Are you seeing your overall numbers are falling? Daily admissions, I would assume, are falling as well. Correct.
They are. And little thing, the ER, for example, every ER in the state, I think, had 10, 12-hour waits. And that's hard. It's hard for people to accept and understand, and particularly hard for the soldiers on the front line trying to, take care of people coming in droves and doing the best they can. It's more tolerable now. There's still a challenge in the ER. For example, at any given time at all three hospitals, we'd have, a dozen people waiting that were admitted, waiting on a room, and now we're down where it's in single digits. And so that's really, really good, especially on the ER and the ICU, and then ultimately on med-surg, and even in the primary care clinics. It's still tough, but getting a lot better. And we're also seeing some, more success stories here lately. We had yesterday a person that was on the vent for 40 days, a very young person that came off the vent and praise God is doing real well. So we're just ecstatic about stories like that. We need more of those.
That is encouraging. As far as your patients, the conversation over the last several weeks had been younger and younger patients in the hospital. This week, we had a report of a one-year-old child, under 1 year old in Mississippi, died of COVID-19. Are you seeing, is the trend still with more younger patients in the hospital?
Yeah, our average age is much lower. It's around 57 overall. There are many younger people on the vent. We still have 26 people on the vent, right now. We have seen, unfortunately, intrauterine fetal demise of mothers that are pregnant. That's most unfortunate. A young mother in the 30-plus week range normally could deliver a baby just fine, and the mother having COVID and losing the baby is just that's as heartbreaking as it gets. And then, we've had deaths of people in their 40s that have, sometimes maybe it's other comorbidities, or maybe just a generally healthy person that wasn't vaccinated that just got it and just due to their genetic makeup just didn't do well. So still tough, and still, a lot younger folks overall that we're seeing than we did in the first couple waves.
A few weeks ago, we heard Governor Tate Reeves announce a plan to offer health care assistance, bring in nurses, other health care workers for hospitals around the state. Are you seeing that assistance trickle in?
Yeah, we are, and we're very thankful for that. I am absolutely thankful for the people we've received that have come to help. Any arms and legs that assist are good, but as I've said, that's a Band-Aid on a problem that needs stitches and staples. I think I've said that before. Long term, these folks, we're paying a lot of money for these out-of-state folks, and that money's not going to be spent in Mississippi. They're going to go home and spend it on Christmas in Texas and California. So appreciate the help, but I think it bears into focus a bigger problem, that we've got a long-term nursing problem that existed before COVID and is going to be exacerbated after COVID for the state of Mississippi with respect to not just nursing, other caregivers, but mainly in the RN realm.
What do you feel like the state's role is in terms of boosting salaries for nurses so that because you've talked about the problem of nurses are just paid much more money out of state?
Correct. Mississippi is one of the poorest states. Mississippi is one of the states that we have the most unhealthy people. So it's tough to be a nurse in Mississippi. And because of that, we've proposed, we call it the Save the Lifesavers program. We're giving money to people federal money to people for unemployment. People that, if you can't find a job right now, that's insane. Every restaurant in America is hiring. And yet we're giving unemployment money out still. We're talking about infrastructure and we're talking about all these things. What about the people that are saving your life? What about them? The warriors that have been fighting this war against COVID for so long and are going to have to keep fighting it. We would like some of the $1.8 billion in federal money that's coming in, just 25% of it, to go towards retaining frontline caregivers in the state of Mississippi. We think that's a long-term solution. We don't want any money to go to hospitals. This is not just for Singing River. This is for the whole state. We have 2,000 less nurses today, 500 less enrolled in school. That's going to be a problem that is going to last long after COVID. So we need more people, to want to be in that profession. And there's no better incentive than to take some of that federal money, give it to the people that have been saving our life. And I think our legislature and every state leader and every leader, period, in Mississippi should be advocating for that.
We did hear from Senator Scott Delano earlier, and he did say that there was discussions concerning this issue. Are you encouraged that this will become a reality? He even brought up the possibility it could be talked about in a special session. Are you hearing this talk?
A little. I think it's going to be, a long shot to have a special session called. What's sad is the special session might be called for marijuana, and we're hoping for marijuana special session to be called so that the nurse issue can be brought in. It's a shame how politics get mixed up in things like that when, we'd like a special session just for nursing, to cure that problem. But if that special session happens, we are optimistic that there may be an opportunity then. If not, then when they go into session in January, it's we need an immediate solution, but if we have to wait, we have to wait. And people are, again, I say this, thank God for the people that have decided to stay, the RNs and RTs and CNAs that have decided to stay and commit to their community for so much less money than they could make at other states. But, they've talked about it. They've said yes. We've had a lot of good, but it's just words so far. We're going to be looking for action.
All right, real quick, where does the vaccination front stand? We have heard rising vaccination numbers over the last several weeks.
Yeah, so those efforts are going very well. We are vaccinating people daily. It's, if this was in the war analogy, the vaccine's the atomic bomb. The hospitals aren't filled with vaccinated people for a reason. And so we like to focus on the fact that it's safe. And don't forget, there's many other arrows in the quiver. People have forgotten to wash their hands, and that makes a big difference. Isolating when you're ill, all of those things on top of vaccinations can certainly help us. But again, as we say, if you've got concerns about the vaccination, talk to a board certified doctor. Don't listen to some obscure quack from Russia on the internet. Talk to a legitimate live board certified physician. Get your answers there.
All right, Lee Bond, good insight for us this morning on COVID-19. Thank you for joining us.
Thank you.